Welcome everyone. We're really excited to share this information on chronic neck pain and headaches. So tonight we're going to learn the most common causes of neck pain, why certain neck pain problems don't get better. We'll talk about old school versus new school thinking on diagnosing and treating chronic neck pain. We're going to do a live demonstration on how we use a sophisticated piece of diagnostic and rehab equipment to assess chronic neck pain. That's going to be really cool for you to watch. Then we're going to open it up to live Q&A. We want to make it interactive and try to address some of your current issues. At the end, we've created a special offer as a thank you for taking the time to sit in on this webinar. So let's get started. Before we get going, just a bit of housekeeping. We ask that you keep your microphone muted and your video off. If you have any questions or comments, just type them in the chat and we'll try to answer them. If we can't respond during this workshop, then we'll get back to you in the next day or two. So the three most common causes of neck pain, or what we call mechanisms of injury, are the first one is trauma. This is where there's high amounts of stress and strain. So examples can be motor vehicle accidents, sports injuries, and slips or falls. The second kind is what we call repetitive strain injuries. These are a little harder for people to understand because there's low amounts of stress and strain repeated frequently that build over time to finally create injury to the neck tissues. Examples include lifestyle and postural strain, such as working at desks and computers. I know there's been none of that during this COVID thing. It's now so common, it's gained its own little moniker we call tech neck. People working on their phones, sitting at desks, sitting at computers, all of that stuff. The third is usually a combination of the two. So let's say you may have been injured in an accident a long time ago and the original injury's healed. However, you continue to aggravate things through your lifestyle and or postural strains via the repetitive strain injury model. Now, traditionally, how neck has been treated follows the structural diagnosis model. The logic goes something like this. In step one, we diagnose the injured or painful tissue or tissues. What we call, we're trying to identify the pain generator. So the idea is once we've diagnosed which tissue or tissues have been injured and are painful, we can organize treatment to fix those injured tissues. And if that's successful, once the injured tissue has been fixed, then the pain will go away and life becomes good again. So how's that worked? Well, research showed that this approach only helps people approximately 20% of the time. That's pretty sad. Unfortunately, a lot of this time, the approach doesn't help and people continue to suffer pain. So what typically happens is that more effort is put into trying to diagnose the injury. We ramp up our investigations and interventions trying to identify which tissue or tissues continue to generate pain. We order tests such as x-rays, CT scans, MRIs, ultrasounds, and the hope is that we must be missing something, and if we can just do a better test to identify the painful tissue or tissues, then it'll point to stronger interventions to fix things. This is where we start to see treatments such as sending people for injections to try and block the pain. Sometimes referral for surgery is even considered as a last resort. Unfortunately, oftentimes when these treatments aren't successful, even with these advanced tests, people continue to experience pain and people are told just they're going to have to live with it. To give you some numbers to show how this treatment approach has worked, Canadian stats from motor vehicle injuries tell a grim tale. For those that are injured in car accidents, 59% will still be symptomatic 6 months later. 25 to 40% will still be symptomatic 2 years later, and approximately 10% will never fully recover. The World Health Organization now recognizes spinal pain, which includes back and neck pain, as the #1 cause of disability in the world. So how can this be? Some research has recently been done to identify the most common sources for ongoing pain. These are what are called the facet joints, which are the little tiny joints that join each vertebrae together. The discs, which is the shock absorbers that sit in between each vertebrae, and the muscles. The muscles can develop things called trigger points, and we also call these myofascial pain syndromes. So here are some of the common places you can feel pain if the facet joints or the discs are a problem. So have a look at this picture and see if this looks like you. If you're feeling pain in these areas, it may be that the facet joints or the discs are some of the pain generators. Now, here are some of the common patterns caused by the trigger points, what we call the myofascial pain syndromes. This is what are called the trap muscles, which are your big muscles on top of your shoulders. So the X's mark where the trigger points are commonly located, and the shaded areas show you where you would commonly experience pain. For the traps, you can see how you may experience pain along the top of the shoulders into the neck, but also they can refer pain into the head. So you can have headaches or even jaw pain. The levator scapula is a muscle that runs from the neck down to the shoulder blade. You'll typically feel pain in the shoulder or in back of the neck, but also down along the spine or beside or even under the shoulder blade. The scalenes are interesting muscles. These are muscles up in the front of the neck. You may have local pain in the front of the neck, but more commonly you'll have pain where the shaded areas show, and we call these patterns pseudoangina or even pseudoradiculopathy, which is a fancy word for nerve pinch in the neck. The reason we call it that is because you'll often experience pain radiating into the chest, again in the back of the shoulder blade, like under the shoulder blade or beside the shoulder blade, or even down the arm. So people will often think they might be having a heart attack or they've got a pinched nerve in their neck sending pain into the chest or arm. The sternocleidomastoid muscle, or SCM, has two different parts to it. It's again in the front and the side of the neck that can refer pain. You can experience headache pain around the ear, the back of the head, in the forehead, around the eyes. Some people will even tell us that they have sinus type pain. So why does the pain not go away? To answer this, we need to take a look at what we understand about how the body heals. Basic science has shown our bodies go through three very distinct phases of healing. Depending on the nature and the extent of the injury, we know these phases take a certain amount of time. Phase one happens early. It's called the inflammatory stage and relates to about the first 2 weeks after the injury. Damage is done and the injured area is swollen and very painful. Phase two is called the repair phase. So once one starts to wrap itself up, you move into phase two. This is where tissues begin to repair themselves. Our immune system moves in and begins removing the damaged tissue and replacing it with new tissue. It's magic. This happens on autopilot. And depending on how bad the injury was, this typically can last anywhere from between 2 and 3 months. 8 to 12 weeks is usually a good time frame. Phase three is called the reorganization or remodeling phase, and this is where the body continuously reorganizes the tissues to better cope with the stresses and strains that the body part experiences. Again, depending on the severity of the injury, this phase takes place over about 2 to 3 months from when the original injury occurs, but it can continue on after that. So the disconnect here is, why would the pain continue if we know the tissues have healed? Meaning if we know that tissues have basically healed themselves within 2 to 3 months, why would the pain continue past that? Well, that question forced us to adopt and change our approach, which we now call the new school thinking. And it improves on the original structural diagnosis approach by adding what's called a functional diagnosis. The functional diagnosis basically looks at trying to answer the question, why do those tissue or tissues continue to cause pain after they've healed, meaning after the 2 or 3 months have gone by? So the idea is, what underlying dysfunction continues to strain the tissue or tissues so they remain painful? As a bit of background, we were involved in a research project way back in 2002. Yeah, that's almost 20 years ago. Wow. This was an international collaborative multi-center project coordinated out of La Trobe University in Melbourne, Australia. We studied more than 400 patients, average age of approximately 40 years old, who had been suffering from chronic neck pain and headaches for more than 8 years. That's a long time to have recurrent or chronic neck pain. We used a sophisticated piece of equipment called the Multicervical Unit, or MCU, to measure their neck function. So this was a functional diagnosis. The machine allowed us to isolate the neck and specifically measure its mobility and strength. We then compared this to normal to determine if there was underlying dysfunction that continued to create stress and strain on the tissues of the neck. This established their functional diagnosis. So what did we find? Well, the main finding was that the mobility actually remained pretty good. There was some reduced mobility, but essentially people kept pretty good neck movements. Unfortunately, though, the main finding was that universally their necks were quite weak. Most had more than 50% reduction in strength when we compared them to normal people. We call this the deconditioning cycle. What that means is when you have pain, your body protects the area by not fully moving it or letting you use it. That's a natural guarding mechanism. So unfortunately, though, when you don't move it or use an area properly, it weakens. That weakness means decreased ability to do your normal activities. It also means that the area is vulnerable to further injury. Further injury means more pain, and the cycle just feeds on itself. So tissues heal, but strength isn't rebuilt. If there's undiagnosed weakness, we know that we're vulnerable to further injury. Also, from a functional perspective, though, weak muscles must work harder to do normal activities. It's just common sense that harder working muscles fatigue and develop trigger points, but also the increased muscle tension from working harder creates more joint and disc compression. This increased compression causes the facet joints and discs to remain painful. Remember back to that slide where I showed the three most common causes of pain are the facet joints, the discs, and trigger points in the muscles, or what we call myofascial pain syndromes. So this cycle connects how ongoing muscle weakness can lead to both disc pain, facet joint pain, and a recurrent development of trigger points in the muscles. You get it again with similar to the deconditioning cycle. As soon as you create pain, the body's natural reaction is to not use the area, and that disuse feeds back into more weakness, and the cycle just keeps feeding or repeating on itself. So if the problem is undiagnosed weakness, then the solution must be to rebuild the neck strength. And this is what we did in that research project. We put those patients through supervised progressive strengthening programs on the neck machine. We call this a program 10 because what happens is we do 9 rehabilitation sessions where you literally come in and under supervision of a chiro or a physio, you go through a progressive strengthening regime targeted specifically at the weaknesses we identified. Then what we do is on the 10th visit, we do a retest where we do the same measurements, we do the same assessment, and we compare that back to how you originally were. So how did we do? Well, the results were impressive. 2/3 of the people we ran through this program improved significantly. On average, treatment took about 6 weeks to complete. People doubled their neck strength and reduced their neck pain by more than 50%. So rather than guessing that this might be the reason you have ongoing neck trouble, this simple test can tell you. It takes about 30 minutes to complete, where we use the neck machine to measure your neck mobility and strength, and we then compare your results to normal. Okay, so I've talked about this test, but I thought it might be interesting that we're going to show you a live demo of how we do these assessments, and then we're going to share the results and finally open it up to you for some questions and answers.
All right, so hopefully that information came across okay. Like I said, we want to do a live demo of how we do these tests. So we've strapped poor Eva into the neck machine. Now, I want to make sure the reason we want to do the live demo is because the machine looks scary, but it isn't really. It doesn't do anything to you. It just simply measures what you're capable of, and then we can compare it to normal. So Dr. Katie's gonna run through just a couple tests. We won't do the full 30-minute evaluation. We just want to show you basically how it works. So yeah, if you guys.
Yeah, great. So as you can see here, Eva's kind of strapped in. We have her waist strapped in here, shoulders strapped in here. And all we want to do is just basically isolate the neck and only make sure that we're getting the true values for her neck strength. So the first test that we do is mobility. Normally we do it in kind of flexion looking down, extension looking up, side bending and rotation. But for today's purposes, we're just going to do flexion and extension for you guys. So we'll go ahead and get started there now. So normally I just like to do a little practice one and see how it feels. So Eva, just kind of give us a practice one there. Good. Does that feel comfortable there? Yep. Okay.
Good answer.
So now we're going to go ahead here and we're going to record it on our computer screen here. So Eva, when you're ready, we're going to do flexion first. So in about 3, 2, 1, go ahead there. And go all the way down as far as you can. Come back up to the top and pause here. And go again. Good. And come back up, pause. And one more here. Good. And stop there. So we do about 3 trials of each of the tests here. We'll also ask you your pain scores just so that you can compare it to your pain scores after you complete the 9 weeks of treatment. So here you can kind of see Eva's scores already, just kind of the graph on how much mobility she has in flexion. And then
just to point out that little, I don't know if you can zoom in, but so the little dotted line there is what we know as normal mobility. So you can see, if you can point out the white line, in flexion, that's normal. And so you can see in all those trials, Eva's graph went over normal. So we know that her neck mobility and flexion is within normal ranges. Right.
Good. And now we'll go ahead and do extension. So I'll just remove this here. So this is the one where we kind of lean back and head goes up towards the ceiling. Okay, give us a practice one there, Eva. Perfect. Good. How does that feel? Good. Good. Okay. Let's go ahead there now. So let's go in 3, 2, 1. Go ahead. Good. As far back as you can and pause here.
Continue.
And go again.
Continue.
Good. Last one here. And back up.
Test completed.
Good.
Same thing, we'd record if you had any discomfort doing that test.
Yes, and then you can see the graph again here, just kind of lining up with normal. And then we'll go on and do strength. So normally, like I said, we do kind of rotation and lateral bending side to side, but we'll just go into do strength here today.
Like I was telling you, the results of the tests we did in the research was that mobility usually wasn't the big issue. There was reduced pain, especially if people are in pain. So mobility was a significant finding. Strength became the bigger issue. So we'll just get it all set up here and then we'll show you how we record strength. And again, we'll probably just do a couple of these. Normally we can do strength measurements in up to 16 different neck positions, so we can really isolate which muscles are weak, or if you've got muscle imbalances side to side that need to be addressed, we can identify those as well. Okay, you good to go?
Perfect. Yeah. So we put a pin in on this side here so that the neck machine doesn't move as much as Eva wants to push against it. It won't move at all. And these black kind of pads here are hooked into this that feed into the computer, and they're going to test her neck strength for her max rep.
So this is what's called isometric neck strength, meaning the neck isn't going to move when she's testing.
Mm-hmm. So we can go ahead and do a practice one there. So Eva, just kind of give yourself a double chin and push forward. Good. How does that feel? Good. Good. And relax there. Yep. So when we do it, the computer's pretty good at telling us how long we hold the contraction till. Then we take a break and then we do 3 sets of this one as well. So when we're ready there, we can go ahead in 3, 2, 1. So go ahead and give us a push. Push, 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 push. Keep going. Good. So that's a 10-second rest in between each one, and then you go again.
4, 3, 2, 1. Continue.
Go ahead again. Push, 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 push. We can kind of see already.
Rest period.
Good.
How am I doing?
You're doing good.
4, 3, 2, 1. Continue.
And last one, go ahead here and push, 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 push. Good.
Test completed.
And then we also get your pain scores too at the end of this one. This is normally when people have a lot of pain, just because, sorry, their neck starts to fatigue, and then that's when they have some of the pain kind of flare up. And then we can see your scores again here. Usually normal for about a female is between 12 to 17 pounds. Here Eva's pushing about 15 to 17, so we know that she's in the normal ranges for a healthy neck for a female.
So this next test coming up is going to be testing the bigger muscles in the back, what's called the neck extensors. These are the ones that are commonly the weakest. And basically what we find is when these muscles are weak, they fatigue very quickly doing normal activities like sitting at desks, sitting at computers, anywhere where your posture makes your head get out in front of your shoulders. These muscles have to work to keep your head from falling forward against gravity. And if they're weaker than they should be, then it makes sense they fatigue, they develop the trigger points in them, and they start causing pain. So this test really is a telltale for whether the muscles are creating or causing or even contributing to your ongoing neck problems.
Okay, give us a practice one there, Eva. See how that
Okay.
feels. Good. And
Yeah,
rest there.
feels good.
Okay, so go ahead here. In 3, 2, 1.
Start
Go
test
ahead and
now.
push there. Push, 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 push.
Rest period.
So again, rest for about 10 seconds.
4, 3, 2, 1. Continue.
Go ahead. Push, 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 push.
Rest period.
And
Just
last.
kind of go around the back here.
Mhm.
So you can see how
3,
the pads are resisting her ability to push backwards. And then the load cell there is measuring how hard her muscles are working. And we're recording it on the computer. And that's how we get the pounds of force she generates using those muscles.
So Eva's at an average there for extension about 24 pounds, and average for a female is about 20 to 30 pounds. So we can compare almost right away. Good.
Okay. So that's a quick live demo of some of the testing we do, but like I said, we can test the neck strength in up to 16 different neck positions and really isolate down to which specific muscles might have not recovered fully. And then the idea in the program 10, if I come around and look, you can see on the neck machine in the back there, it's got a little pinned weight stack. So the fix becomes, those are little quarter-pound weights. And when you come in, you do supervised rehabilitation sessions where you literally will lift those little quarter-pound weights with the muscles of your neck under supervision, so we make sure it's nice and safe and you are targeting the specifically weak muscles, and we gradually build up the strength again, just like a gym workout specific for your neck. So what I'd like to do is jump back to a bit of a screen share so I can share some of the results from that research project. I'll give you a real world example of a lady we recently ran through. This was a lady that was sent to us in a, she had been in a motor vehicle accident, and she was, I think, 4 or 5 years in and still having significant or debilitating chronic neck pain and headaches. So what you'll see here is, sorry, I forgot to share my screen, hang on. Okay, there we go. Hopefully you can see my screen now. So basically on the left-hand side, so these are her test results. And essentially up here, this is a report that shows successive testing. This is her range of motion. So the first test you saw Eva going through where she was moving her neck fully in flexion and extension. These were all the results of this lady that was injured in the car accident. When we first tested her, that's the left-hand graph here. You can see mobility isn't really a problem. When we first saw it, in lateral flexion, like bending down to the left and bending down to the right, was quite stiff. The red lines represent normal. Subsequent tests would be, so the left-hand graph represents when we first met her and measured her. The middle graph represents when we, after we'd done 3 weeks worth of rehab, we re-examined her, and then the right-hand graph was 3 weeks later after she'd gone through a second rehab session. And you can see her mobility pretty much reached the red line, which is normal in all movements. This area down here is the same time frames, except this is her strength measurements. So when we first started, so this left-hand graph, in flexion, which is pushing forward, her muscles, she could generate a maximum force of 8 pounds of force. And as Katie just mentioned, for women, we want them to be able to generate between 12 and 17. In extension, she could do a maximum of about 12 pounds, and we want her to be able to do between 20 and 30. Pushing to the left, she could do 8.5 pounds, and pushing to the right, she could do 6.5 pounds. And again, we'd want her to be in around, say, 15 to 20 pounds in lateral flexion. So generally quite weak when we met her. And so as you look for progressive, so when we trained her for 3 weeks and then remeasured, she'd gone from 8.1 to 9.2 in flexion, 12.1 to 17.5, 8.4 to 10.2, 6.5 up to 9.8. So she's improving, but she's still not back within those normal ranges. So what we did was we organized a second go round for her. So she did another 3 weeks of rehab, and then we subsequently remeasured. And then on that test, she did 15.5 in flexion, which is now within those normal ranges. She did 24.6 in extension, which is normal, 17.5 in left lateral bending, and 18.5 in right. The other interesting thing is this right-hand graph. What we do is we have you complete these questionnaires. They're simple check boxes that tell us how the neck pain is directly impacting your normal activities. Things like driving, reading, sleeping, recreational activities, and it translates into a percentage of disability. So when this lady first met us, she scored 22% disabled according to how she rated her perceived disability. Halfway through, she answered the same questions, and that scored her to show her neck pain and disability had been reduced down to 12. And at the end, she had reduced down to about 6. So what we were able to do, so 6% disability equates to roughly, you have some neck stiffness, but it doesn't really interfere with your normal activities. So basically the take home there is we rebuilt her strength over about a 6-week period of time. She, She increased her flexion strength by 91%, her extension strength by 103%, her left lateral bending strength by 108, and her right lateral bending by about 190%, like crazy improvement, and we rebalanced that. But that correlated with her perceived disability rated to her neck pain reduced from original 22% down to 6, which is a 73% improvement. So basically, what I want to do now is just open it up to questions and answers. Well, hopefully we'll have answers. If you want to type in the chat room, if you've got any specific things you want us to address, just type it in the chat and we'll try and answer it right now. Or if you're interested, and we can also put you on the mic and you can kind of describe it, describe what you're experiencing. Anybody want to type in? Okay, we've got one. I'm guessing that then that you do the test until you find the muscles that are the weak ones, or do you do all 16 positions? Yeah, good question. We don't have to do all 16 positions. We have a standard protocol, and it's only if we see things, so that ends up being, we only need to test about 5 or 6 positions to get a good overall snapshot of how your neck is doing. If we're seeing glaring muscle imbalances, we may add additional angles and try and target individual muscles, but we don't need to do all 16. So like I said, the whole test takes only about half an hour to do. Any other questions? Just curious, did those screen shares come across okay? Were you able to see things properly? It's hard for us to tell on our end. Yep, everybody says, yep, no problem. Okay, I've got another question. Differentiating when pain is chronic versus acute. Do you wait more than 3 months to know? Yeah, that's a great question. So by definition, pain that lasts longer than about 3 months is starting to be defined more as chronic. So typically we would wait certainly 8 weeks and 12 weeks. And if we're not seeing significant recovery milestones within that time frame, we would get the neck pain or the neck functional assessment done. I've got another question. Do the improvements after the strength building sustain after the sessions long term? And that's another great question. So the answer is yes. What we did was we followed all of those 400 patients for about 2 years. And I believe it was 85 to 90% of them maintained their strength for that entire time. Naturally, when we finish the neck machine, we give them home exercise stuff that they may need to do, but most of them were just able to get back to the normal activities, and they maintained it. I've got a question. How much does this cost? It costs the normal chirophysio rates. We just bill it out as normal physiotherapy typically. I've got another question here. And if you hang on for the how much does this cost question, we've got this offer. We're gonna, anybody on the webinar, we've got a special offer for them at the end here. I've got another question here. With the example of the patient you just showed, how many sessions per week did she do? It's called a program 10. So you come 3 times a week. It's like going to the gym. The workouts take between 15 and 30 minutes to go through. So it is a commitment. You come for a total of 3 weeks, and then we run a reassessment and compare that back to normal or to baselines. Any more questions?
Maybe just mention that, like,
Can neck strengthening exercises decrease nerve pain radiating down to the arm to the hand? So what we do is before we put you on the neck machine, we need to assess if the pain radiating down to your arm or hand is truly nerve pain, or whether it's actually being is coming from these trigger points. But the answer is yes. There are certain types of nerve pinch that are relatively contraindicated, meaning you may need to do something else first to settle that out before we would put you on the neck machine. Again, we would need to do an assessment first before we just jump right into having you do the neck treatments. But yes, we can treat what's called radiculopathy, which is nerve pinches.
I don't know if you want to mention that, like Blue Cross sometimes covers.
Yeah, just to get back to the person that had the question about the cost of the treatment, because it's billed out and our supervisors are, you're in the room with either a chiro or a physio, then you'll be able to, if you have insurance coverage for chiro physio, it would cover this type of treatment. It's just general rehab, the same as what we would do, giving you exercises for any other body part. So you can keep typing in questions if you want, and we'll try and get to some more. I'm just going to do one more thing for the screen share here. So basically what we're doing for everybody that's on this webinar, if you type in the chat, we're going to offer you a complimentary or no charge consultation on the neck machine, basically. So all you would need, we can do this assessment the pre-screen. We can do it on the phone or in telehealth, or you would come into the office where we would meet with you and go through a screening just to determine if you are a candidate for the test. But if you are, then we would put you through the test for no extra charge. It would be free. So if you're interested in that, all you need to do is type in the chat, neck pain test, please. Or of course you can call or email us. But what we'll do is if you type in the chat, then we'll just reach out to you, one of us, and just chat with you quickly on the phone to go through a pre-screening just to make sure you don't have anything that would be a contraindication to getting the test done. All right, so basically what I'll do is that's essentially the information share. Again, if anybody, yeah, we've got a lot of people testing that say they want to have the neck pain test done, so no problem. Basically, yeah, just type in neck pain test, please, in the chat, and we'll be getting back in touch with you. And as I said, especially for the person that was wondering about cost, because you took the time to jump on this webinar, we're not going to charge for this intake assessment. And then you're not guessing to see, you'll just know within half an hour whether whether your neck weakness is there and whether it might be contributing to your ongoing neck problems. Great. While we're waiting, yeah, there's lots of people asking for neck pain tests, so no problem. We'll just reach back out to you. If for some reason we have a IT glitch and we don't get in touch with you, you should hear, it's Tuesday today, so you should hear from one of us by the end of this week. So if for some reason you haven't heard from us, make sure you give us a call here at the clinic, and one of us will jump on the call with you to follow up. So we'll wrap up now. Does anybody have any other specific questions that you wanted us to address? All good. All right, everybody. Well, thanks very much for taking the time. As mentioned, I see some of you that left your cameras on are holding your neck. So we might even have to talk about ergonomics when you're sitting on your computer, but no problem. Thanks very much for taking the time. I hope the information was valuable and the demo was good, and we'll look forward to catching up with you in the future.
Thank you. Thanks, guys.